In this video, we will show you the basic exercise program you should perform after hip surgery to help you recover. Do the exercises slowly with control and don't forget to breathe. You should perform these exercises 3 times per day. Begin the ankle pump exercises by lying down on a flat surface such as your bed with your knees straight. Move your ankles up and down to point and flex your toes. You can also move your feet in circles. Repeat continuously 10 to 20 times. For glute squeezes, remain flat in bed with your legs straight. Tighten your buttocks muscles by squeezing them together. Hold for 5 seconds, then relax. Repeat this 10 to 20 times. For quad sets, start with your operated leg straight on the bed. Tighten the muscle at the front of your thigh as you press the back of your knee down into the bed. Hold for 5 seconds, then relax the muscle. Repeat this 10 to 20 times. For heel slides, bend and straighten your operated leg by slowly sliding the heel along the surface of the bed. Repeat this 10 to 20 times. To complete the short arc quad, you might need to get some help to place a folded pillow or a large towel roll under your knee. Lift your heel off the bed until your knee is as straight as possible while keeping your thigh and knee rested on the pillow. Then lower your foot down slowly, avoiding letting it drop rapidly. Repeat this 10 to 20 times. For knee extensions, start with your feet flat on the floor, then lift your foot forward until your knee is as straight as possible. Lower back down slowly. Repeat this 10 to 20 times.